YouTube is known for their stellar algorithm that captivates all users down a rabbit hole of videos. But how does this happen? Through the videos we voluntarily watch, YouTube collects any relevant information about the user, including political beliefs, preferences, and interests that will create a personalized list of recommended videos to fit that person's liking. This is seen everywhere in social media. For example, taking on the recent controversy of ivermectin, there were splits regarding the efficacy of the drug against COVID-19. If a user encountered a page that provided support for the use of ivermectin against COVID-19, social media platforms will continue to suggest videos and articles that provide supporting evidence for this view. Their recommended articles and videos will be tailored to their specific taste and opinions, differing from user to user. In contrast to the personalized algorithms YouTube uses, algorithms used in healthcare are quite generalized. While the algorithms used in healthcare are meant to serve an individual, they provide a generalized output collected from the public rather than a specific individual, which creates two major problems regarding diagnosis and treatment. 1. It cannot provide a personalized diagnosis as sophisticated as a physician, which can direct different patients to receive similar diagnosis and treatment plans. A second problem is that because algorithms rely on databases of the public, the dominant ethnic population can influence the database. For example, darker-skinned patients have a harder time being diagnosed with skin conditions, since the majority of the algorithms used in healthcare rely on data from Caucasian patients. Such biases embedded in algorithms are reflective of the disparities present in society. Consider a study done using a widely utilized AI system in the American healthcare system. In this study, it is reported that algorithms determining the level of risk and urgency in patients were racially biased. The researchers found that the algorithm assigned risk scores to patients on the basis of total healthcare cost accrued in 1 year. While there's no issue to this logic at face value, since non-Caucasian patients were more likely to have a lower SES status than Caucasian patients, the non-Caucasian patients generally spent less money on healthcare than similarly aged Caucasian patients, which placed them lower on the risk level. As a result, they experienced delayed and less personalized care, which influenced important healthcare decisions. So, this bias is clearly an issue, but what can be done? To address this issue, AI should aim to gain diversity in the datasets that it learns from to account for population variability. Since many AI algorithms learn from large datasets that lack equal representations of ethnic and gender minorities, immigrants, and persons with disabilities, these individuals are prone to receiving misdiagnoses, which can lead to fatal treatment outcomes. By implementing an anti-algorithm that recognizes and flags datasets with low variability, the user would be warned about the lack of generalization and a possible risk of bias in the output that could influence their decision-making. Through the use of anti-algorithms, misdiagnosis, and generalization due to the reinforcement of biases from current algorithms would be combated, and medical professionals would be able to make less purely data-driven decisions and would also be given more opportunity to practice more impartially.